Hello friends, we are discussing here a very complex fracture of proximal femur in a young adult. And fracture is a very complex one with three-part fracture. And you can see there is large butterfly middle fragment. And on C-arm, even after traction, the all fragments are not reduced and they are all separate pieces. And we have to manage this case with minimal invasive proximal femur nailing. In lateral view as well, the displacement of the fracture is significant and we have to reduce it well. So we manipulate the fracture to gain a satisfactory alignment. Then we use Cerclage method to bind all three pieces together. So we use a special device called a wire passer, which is used to pass Cerclage wire in minimal invasive method. First, we have to ensure that the wire passes and collects all fragment together. Then we also make sure that the prongs or tongs of the wire passers are aligned. Like in this case, it is not aligned. All the circle is not complete, so the wire will not pass. So this is the correct alignment. Now the wire passer is removed and the wire is ensured that it collects all the fragment, and gradually it is tightened, and we can see that the wire reduces all fracture fragment very nicely and securely. Now the nail is passed in a standard manner and wire is again tightened well to reduce with the nail, and confirmed in AP and lateral view the proximal screws are also fastened. So this completes the encirclage wire with PFN, and now the fracture reduced very well. The post-op X-ray, we can see it is a well-reduced fracture. So that was a demonstration of encirclaging technique for complex fractures. Thank you very much.